listening to Engage on Central Florida Public Media. I'm Sharon Stone. Coming up, we'll learn about a program assisting women in the months following birth when the health of baby and mother can't be forgotten. And Engage stops by Camping World Stadium to meet monster truck driver and Orlando resident Bari Musawwir. Our conversation with Monster Jam's first black driver is later in the hour. But first, measles cases in the U.S. are climbing, and we're heading into the busy spring break season here in Central Florida. Millions of people will use Orlando International Airport, and MCO reports that this Saturday is expected to be the busiest day of the spring break travel period, when some 200,000 people will move through the terminals. Cases of measles are rising in outbreaks happening in Texas and New Mexico, and 2 people died from the disease. Last week, Florida confirmed its first case of the year. A student tested positive at a high school in Miami-Dade public schools. Measles is highly contagious and can cause severe illness, including pneumonia or encephalitis in rare cases, where swelling in the brain can lead to permanent damage, blindness, and hearing loss. Many doctors are fighting misinformation about the highly contagious virus and are working to inform people that the MMR vaccine is the most effective way to prevent infections. Dr. Chad Nielsen joins Engage. He's the Director of Infection Prevention for Nemours Children's Health Florida and based at the Lake Nona campus. He starts this conversation by explaining why measles is back after it was declared eliminated in the U.S. in 2000.
The primary reason we're seeing measles here rising in the United States and really globally amongst a lot of first world nations is due to vaccine exemptions, really. We're starting to see less public trust in the vaccines. And so the particularly hard thing about fighting measles is if you don't have a highly vaccinated population, typically 95% of people need to be vaccinated against measles to stop an outbreak. When that vaccination number gets lower than 95%, that's when you start seeing cases of measles rise. Measles is unfortunately one of the most infectious diseases known to man, so it's more contagious than anything else. And so just one case of measles can spread to 18 other people if they are also unvaccinated, which is why you see an explosion of cases happen very shortly after just one case, if there are others in that community that are not vaccinated.
What makes it so contagious? How does it spread?
So measles spreads via droplets. So if you're infected with measles, you have infected droplets in your nose, in your throat. When you talk, when you cough, when you sneeze, those droplets then go airborne. They can land on something. If you touch that something and rub your nose or your mouth, you're allowing that virus to get into you. The scarier thing about measles is it's airborne. So what that means is when you cough or sneeze infected measles droplets into the air, that droplet can hang in the air for up to 2 hours. So somebody could sneeze, let's say in Publix or in Walmart or wherever they're shopping and move on with their life, but somebody comes right behind them for 2 hours, breathes in the air they sneezed, and could be potentially infected with measles. That's what makes it so contagious, is because it lingers in the air for long periods of time. Now, the good news is it's easy to kill that virus. Standard household cleaning, disinfectants, bleach, your typical Lysol, those things are all effective at killing measles. But when it's in the air, it's in the air. And that's where it becomes particularly contagious.
Dr. Nielsen, we're heading into spring break, super busy travel time, a lot of tourists in Central Florida. Orlando International Airport even said their busiest travel day is expected to be this Saturday, March 15th. 200,000 people are going to be moving through the terminal complex. Can you speak to concerns about this influx of people traveling here when we're seeing a really contagious disease spread?
Sure. And this, again, harks back to days of COVID-19, right, where we had a very contagious illness moving through airports and vacation areas and theme parks and stores and all of this type of potential exposure. So we are worried about that in the community of public health and hospitals. We have a lot of people coming through our airports. We have a lot of visitors coming from out of state. I think that what we will see is probably after the spring break period, 7 to 14 days after, is when we would potentially see cases. Typically, when somebody is infected with measles, they don't show symptoms for about 7 to 14 days. And the scarier part of that is they actually become contagious before they show symptoms. So what that means is we're going to have a lot of people here in Central Florida or in any vacation spot in the state of Florida, and they could potentially be carrying measles if they're unvaccinated or otherwise unprotected and carrying the infection. And we're not going to know about it until after the fact. So I think it's a great opportunity for parents to review with their pediatrician or adults to review with their physicians about their status of measles vaccination before they travel, and particularly for those who are eligible to get the vaccine and comfortable doing so, that you please do so before travel and putting yourself or your family at risk of measles.
There were cases of measles last year in South Florida. What's
Mhm.
happening this year that's different and perhaps concerning to you?
Well, if you look at the overall numbers of measles in the United States, last year we had a little over 200 cases of measles in the entire United States, and some of those cases were in South Florida. This year, in 2025, through the first, we'll call it 2.5 months, we are poised to surpass the entire number of cases of measles we had in the US alone. So we have over 200 cases now, and we will surpass that most likely here by the end of March. So I think what we're seeing is just a continued decline in vaccination rates in protection against measles. And that's what we're poised to see now is with falling vaccination rates, especially against measles, it allows more opportunity for the virus to spread. And that's exactly what we're seeing, unfortunately, year after year for about the last 10 years.
That was Dr. Chad Nielsen, Director of Infection Prevention for Nemours Children's Health Florida. The CDC tracks the number of reported measles cases. They report most of the 200 plus cases are among children who did not get the MMR vaccine. Dr. Candace Jones is an Orlando pediatrician with Orange Blossom Family Health. She joins Engage to answer some of the questions she's getting from her patients' families.
As a local pediatrician, I have probably more brought up the conversation of the measles epidemic that we're seeing in our country with parents as a way to share the importance of vaccination. I have had some families ask about measles, what's going on with younger babies, if there is any way to protect their kids, or have we seen cases in our local area? Should they be concerned? So, yes, there are various ways that I've been having that conversation.
What do you say to the parents?
So, in the setting of younger children who are not in the vaccination range for measles, which we recommend the MMR vaccine at 12 to 15 months, anytime in that range, and then the second dose between 4 to 6 years of age. So if a child is under that 12-month-old age, then I would not recommend in our local area at this time because we are not experiencing an outbreak. But if you were to travel with your child to an outbreak area or area that has high rates, or you're in an area like that, you're moving or something, then it is recommended if your child is 6 months or older that they can get their first dose of MMR to impart some protection. We cannot do anything under 6 months, so those kids are still vulnerable. And there are things parents can do to try to protect their kids in that age range.
What are those things parents should do if they're in that age range?
Yeah, so it's very important that when we, talk about that herd immunity, that everyone around the children are vaccinated. So grandparents, parents, if you are fully vaccinated, then you are protecting your child, right? Also, you're protecting other children in the whole community. So that's how that works. Also, if a mom has a newborn, then breastfeeding imparts some passive immunity. Other than that, if you're in an outbreak area or you're going to travel, I would suggest that you sort of keep your child home or indoors, away from crowds in that setting, and then always practicing good hand hygiene. This is a airborne respiratory droplet virus, how it spreads. And so any measures to protect against picking up that virus would also be helpful.
Do you find yourself having to convince parents that the vaccine for their kid is safe?
So first I want to say the overwhelming majority of parents are still vaccinating kids. And that's what keeps me going. Most families I see, they are vaccinating their children. But we do know that rates of vaccination refusal and declining to get immunizations is increasing slightly. So I do see that more and more, and that is disappointing and frustrating because it puts us all at risk. So I am seeing that more and more.
What do you say to those parents who are opting out and say they don't want to get the vaccine?
So that conversation can go so many different ways. I try my best as their pediatrician whom they've chosen, and I hope they trust me. And I just give a strong recommendation for the vaccines and why they're safe, why they're effective, how they save lives, and how it's important for all of us to protect each other. Then I ask if there is any particular concerns that the family has. Why are you choosing not to vaccinate? And then I try to answer or address those concerns, and I try to give credible, trusted information to families, like the Vaccine Information Center, where you can pull up vaccine ingredients, where they have answered all of the conspiracy theories and all of the questions that parents and concerns that parents have that make them hesitant about vaccinating their children. And also other sources like healthychildren.org with the American Academy of Pediatrics. So I have my strategy. Sometimes it still doesn't work. Of course, being at a federally qualified health center, we do not turn anyone away. And so I am seeing more families not vaccinating, and it is very concerning.
I'm just wondering if your job has gotten harder in recent years. And I asked because I was talking to a mother who was telling me when she was growing up, you just trusted your doctor. It wasn't this distrust of vaccine. Like she got the vaccine growing up because that's just what you did. Is it harder for you to be a pediatrician now?
I'm still the same pediatrician. I'm still practicing the same way, but I would say it's heartbreaking. Um, I've had some conversations with parents that can be confrontational, and that shouldn't be. It can be argumentative. There's a level of distrust there for many reasons, not necessarily of me, but me being part of a greater health system. Although I understand that parents love their children, they want to do what's best for their kids. They think they're doing what's best for their kids with the information that they have researched and the things they have consumed. I just think they are misinformed. And that is what's concerning, that because of misinformation and disinformation, families who I can say 100% of the time, families that choose not to vaccinate the parents are fully vaccinated. They're fully vaccinated, but now they have children that they're choosing not to vaccinate, or even older kids who are fully vaccinated, but now the younger ones they're not vaccinating. So they've reached an epiphany of some sort. I had a mom recently tell me that her child is 4, he's fully vaccinated up till 2, so he's had the MMR varicella vaccine, totally healthy, wonderful, beautiful kid. But at 4, now she does not want to vaccinate, and she is so thankful for RFK Jr. I'll ask her where she got her research from, and she believes all the bad stories and all the bad things that she sees throughout social media. She reads the comments, she goes and looks at all the videos. She believes everything deep in her heart and that they are harmful, and she will not do that to her child. And so, what can I say?
Are there preparations you're taking? Are you preparing to see cases at some point?
Honestly, I've never seen measles. I searched my brain to think, okay, all these childhood immunizations, people aren't vaccinated anymore. All of us doctors are having these conversations. Okay, what have I not seen? Let me go back and really look and study to make sure I don't miss this, right? And so this is something that I've done to prepare myself to make sure that I put that back on my differential diagnosis when a child presents sick, especially with fever, and especially when they're not vaccinated. Because if a child is fully vaccinated, we don't really consider it. That's how effective vaccines are.
Dr. Candace Jones is an Orlando pediatrician with Orange Blossom Family Health. I also asked her about treating measles with vitamin A. The Florida Department of Health website states it may be beneficial. And here's Florida Surgeon General Joseph Ladapo speaking about it last week.
My friend Robert F. Kennedy Jr. has been taking some heat for making a recommendation around vitamin A, but that's completely a good idea for anyone who is severely ill from measles. It's a great idea. You take it as recommended. You can do it with your physician. You don't take it for like weeks and weeks, but 2 days of vitamin A, which is the recommendation, there's some evidence for it. There's really no downside to doing that. So that's absolutely a good idea.
Dr. Candace Jones says vitamin A cannot be given to prevent measles, but it has been used as a treatment to prevent blindness and different complications that come with the infection. Measles can deplete the body of vitamin A, which is important for the immune system and vision, among other things. Dr. Jones cautions parents they must be careful and make sure vitamin A is monitored and deemed necessary by a physician.
When we hear you just need vitamin A and parents start to give their kids these doses of vitamin A and they don't know what they're doing or how much and how long and how often, that's where I get concerned because vitamin A is a fat soluble vitamin, vitamins A, D, E, and K. And so if you take them and you take too much or too much at one time or too much over a period of time, it can cause toxicity. It's not like some vitamins that we just urinate out, right? So you can take high doses of it. This can build up in the body, in the liver, and you can have toxicity and serious side effects and even death.
Again, at this point, there are no confirmed cases of measles in Central Florida. A high school student in Miami-Dade public schools tested positive. That made me wonder about how schools in Central Florida monitor for cases and proceed if there is one. I decided to start by reaching out to our largest public school district. A spokesperson for Orange County Public Schools referred me to the Florida Department of Health. I moved on to our next largest district, Polk County Public Schools. And I want to share their response to my request for information about monitoring cases and the process if there is one. Polk County Public Schools works closely with the Florida Department of Health in Polk County. Any case of measles is reported to the state by the child's medical provider. The DOH's epidemiology department monitors all reports of measles and would notify the school if a case was identified. That said, if a school was made aware of a potential case and the DOH had not already reached out to them, the school would reach out to our RNs, who would follow up with the DOH. At that point, the DOH would investigate the veracity of the information. If a case was identified, the DOH and our superintendent would decide the best course of action for the schools affected. And we want to hear from you. Did you get measles as a youth? Or were you spared via vaccines? Are you vaccinating your children? Or are you skeptical about their safety and efficacy? Share with us at engage@cfpublic.org. Pregnancy is typically divided into trimesters, first, second, and third. A new AdventHealth for Women program focuses on the fourth trimester, the 12 weeks after delivery. Coordinators work with mothers enrolled in this initiative before they leave the hospital on how to take care of themselves once they get home. This program to strengthen postpartum care was formed in response to an alarming trend. Hospital data showed higher readmission rates for Black and African American mothers following C-section delivery compared to white mothers, and postpartum high blood pressure was the leading cause for readmission. AdventHealth for Women's Fourth Trimester program empowered Eliza Gordon with the knowledge and tools to recognize that something was seriously wrong with her health and she needed quickly to get back to the hospital. It happened shortly after she brought her third child, a little girl named Trinity, to their home in DeLand. Eliza Gordon joins Engage to discuss the role of the fourth trimester program in her family's well-being. She starts our discussion by sharing how she knew she needed to get back to the hospital.
So during the hospital stay at AdventHealth for Women, I did receive a pamphlet from the staff about like certain signs to look for because I came into the hospital for preeclampsia, of course. So what I didn't realize is it can still affect you after birth. So when I got home, I noticed my legs were really starting to swell up, one leg specifically. I believe it was my right leg. It was really, really swelling up. So at that time, I decided I should take the tip I learned from the hospital, which was to take my blood pressure. And they had provided me with an at-home blood pressure cuff, which was amazing. So when I took my blood pressure, I can't remember the exact reading, but it was very elevated. I want to say my pressure was 160 over something. So that indicated to me that something was wrong.
How did you feel? It sounds like that would be just a scary moment. You've just got home with a new baby, and then, something isn't right.
At that time, I remember feeling honestly worried and a little bit aggravated because we had just got home after being in the hospital, probably for about a week. My younger kids missed me a lot, so I really did not want to go back to the hospital at all. I remember feeling like, gosh, I just really don't want to have to go back. We literally just got home.
And preeclampsia is a complication that causes high blood pressure, either during pregnancy or, as you learned, soon after. That can be a
Correct.
rather serious life-threatening condition.
Yes, it definitely can be. That's why I'm so thankful for the program because I think, when you experience it, sometimes you can just take certain things for granted. And I kind of did take it for granted. I kind of didn't realize the severity of it. So I am happy that I was educated at the hospital about the signs and symptoms to look for and how severe it can be, because that is what encouraged me to ultimately go back to the hospital.
That program you were talking about, AdventHealth created the fourth trimester program to provide care in the 12 weeks after delivery and also to empower Black women to prioritize that postpartum health. Tell me why you described this fourth trimester program as like having a big sister in the hospital with you.
Yeah, I described having the program as kind of like specifically Erica. I believe she heads that program, the fourth trimester program at AdventHealth for women. I described her as a big sister because honestly, she was there advocating for me when I didn't know what to advocate for. When you go through labor and delivery, it can be really exciting, but also stressful and overwhelming. And a lot of times you're just so focused on the baby. So I love that this program brings us back to focusing on ourselves and advocating for our health and needs.
I was wondering that if, as a new mom, do you even think about your own health or are you just solely focused on the baby being okay?
Yes, definitely. And with her being born at 35 weeks, my main concern was, is she breathing okay? Is she going to have to go to NICU? Like, my joke was like, I don't care about myself. And it's really sad, but sometimes as a mother, we're just so used to putting ourselves last and putting our kids first. So again, that's why this program was such a blessing because even after eventually I was released from the hospital, they still did weekly checkups to make sure that I was okay. If I needed something, if I needed a ride to a doctor's appointment, this program really was providing that. I remember at one point I even needed help finding a postpartum care provider, and the team was so helpful and so responsive. And it just takes that one little thing off of your plate to make your life so much easier when you already have so much going on.
Do you think you could visualize maybe where you would be now had you not had this program?
Honestly, if I didn't have the fourth trimester program, I think it would be a little bit alarming. I think education is so key and so important in having advocacy because if you don't know the signs and symptoms to look for, it's easily something where you could be like, you know what, I'll deal with this pain, I'll deal with whatever's going on with my body the next day. And it's such a good reminder, we just never know what may happen. So I'm thankful that I had those nuggets already or those seeds planted in my mind during my hospital stay to really push me because, like I said before, I did not want to go back. Mind you, I'm taking my blood pressure. It's about 2 a.m. That's not an opportune time for someone to get up in the middle of the night, especially with a newborn and two other small children. So without it, I don't even want to think about that because you never know. And you never want to discard how serious a health condition can be because having severe blood pressure that high, you can start having seizures. You could possibly stroke out. So I don't even want to think about that. So I'm really thankful that the hospital provided such an amazing program.
And Eliza, it sounds like in addition to what it's done for you, this is actually benefiting your entire family.
Exactly. It is. It is. And then on top of that, my husband, he was also present when the fourth trimester program representatives came into the room. So he even got some education that I'm sure he did not know about to really help me like say, okay, like, honey, no, remember what the lady said at the hospital? We need to have this checked out.
And Eliza, how are you doing now? How is Trinity doing now at 6 months?
I am doing good. I'm really starting to feel back to myself, so I'm really thankful for that. And Trinity, she's just growing so much. It's so crazy just watching how fast they grow up, but she's doing amazing, and her brother and sister just love her so much.
That was Eliza Gordon. She connected with Erica King, a care coordinator for AdventHealth for Women's Fourth Trimester program. Erica works one-on-one with moms, ensuring they get the postpartum care needed. She also educates them about managing high blood pressure and other health concerns. Erica King joins Engage to discuss her commitment to reducing maternal morbidity rates. To begin, I ask Erica what information new mothers need to know more about.
The blood pressure.
Okay.
They're not really aware of the signs of blood pressure because they think, oh, I'm just having a headache because I haven't had time to eat. I haven't had time to eat because I've been taking care of the baby. So they're not really aware that no, it's a headache I'm having. It could be my blood pressure is high. So that's why we kind of let them know, when you're having certain symptoms like you're having a little bit of gas under your, like a little pain under your breast area, or you're having a headache, or you're seeing blurry vision, floating spots, stuff like that. I need you to sit down and take your blood pressure on the machine that we gave you and just document it. And if you're in good range, that's great, but you can still also call your doctor if you're having those symptoms. And from there, the doctor will let them know. But like they just wouldn't pay attention to those symptoms. They would just think, oh, it's because I haven't had sleep. Oh, because I haven't eaten. But no, it's a real thing when you're in your postpartum stage.
I think pretty much any woman can relate to putting off their own needs in terms of health or just writing it off as something minor. Can you help me
Right.
understand the women that you're working with? What is the consequence of ignoring those signs of high blood pressure?
Some moms can stroke out. I don't want it to sound real graphic,
Mhm.
but they can die and leave this earth and leave their family members and their precious babies behind. That's why we make it so important. And we make sure that we make a connection with each mom that comes through here.
Did you work with Eliza Gordon?
I did.
So I spoke to Eliza, and she described this relationship with the program as like having a big sister. What do you think about that description, and why do you think that relationship is necessary?
I kind of get emotional when people ask me about Eliza now. What I did for her, I would do for anybody who needed it. So it's just the fact that she needed someone to basically back her up. I think I got her paper signed for her maternity leave so she could know what to do because she was like, oh, I just don't know what to do. And I was like, don't worry about it. I got it. Just tell me who your doctor is and we'll find a way to send this paperwork back.
What makes you emotional? Why did you get emotional thinking about that relationship?
Because she needed help. And I feel like a lot of moms need help. I kind of call myself like a mother bear because if I can relate, like my nephew just had a baby. And so when his girlfriend had the baby, I became like real protective. And I just put on that force because, sometimes moms don't speak up because they feel like, oh, I had this baby, so this is my responsibility. No, you need to know that you have a village here and that you don't have to do this on your own. So when you see moms like that, and Eliza already has a toddler. And so I could understand the amount of stress and frustration that she was already under. So it's just the fact that she appreciates me that much, I guess. And it just makes me emotional because I'm actually making a change.
Erica King is care coordinator for the Fourth Trimester program. AdventHealth for Women is already expanding this initiative. They found that since its inception, there's been a 20% reduction in readmissions for Black mothers who had C-sections. This program tackles the racial and ethnic disparities that exist in maternal morbidity and mortality in the U.S. The National Institutes of Health reports that compared to white women, Black women are 3 to 4 times more likely to die from complications during pregnancy or the year after, and the majority are preventable. Dr. Rizwana Farid Dudeen is the Executive Medical Director for Women's Services at AdventHealth for Women. She joins Engage to discuss changing those statistics. She begins our conversation talking about the trends AdventHealth saw that compelled them to create this program.
Nationally, we know we have data that adverse outcomes in our Black moms, our Black and African American moms, are much higher than in other cohorts. And so when we were approached to design a health equity project, one of the first things that popped up was our readmission rates. And there was a very obvious discrepancy between our Black and African American patients versus our white patients, much higher readmission rates in our Black mothers, especially those that had undergone cesarean delivery. So we were looking at this data and we see these numbers. The question was, all right, well, what's some of the things that we can address in a hospital setting as to why these women are getting readmitted? And what we found was that the overwhelming majority of these women were being readmitted due to high blood pressure, which trended because nationally, postpartum high blood pressure postpartum is a leading driver of readmissions after discharge once you've delivered. And so as we focused in on this work and worked with this team to create this fourth trimester program, we realized that blood pressures are one part of it, but also ensuring that moms have access to care. They've got transportation. Do they have food? Do they have a safe environment for baby? Were they able to get their prescriptions? You can't get mad at someone to not take their medication if they weren't able to get it in the first place. So how are we able to ensure that these moms were set up to succeed once they went home and that they were coming back to the hospital for the right reasons? Because we don't want people not coming to the hospital when they need to, but what we wanted to do was avoid people having to come back when they didn't need to.
Why Black women specifically?
So that's a great question. We see over and over that, well, a couple things. One, the historically minoritized and marginalized communities that did not have access to resources versus other communities, it's almost as if they've always been playing from behind. And then we get surprised that they're not doing as well as other cohorts or other communities. Systemic racism plays a role. Unconscious bias plays a role. When you look at so many of these women in some of these communities, we think, okay, hey, well, why didn't she take her medication? I sent the prescription. Well, we didn't stop to think that the nearest pharmacy to her home is an hour away. When we look at all of the health policy and just you think about just laws in this country over decades, redlining, access to opportunity, to education, all of those things that set people and communities up to succeed were not available to so many of our Black communities for so long. And so really closing those gaps is really part of this work. And so much of health, I think it's 80% of health that happens outside of the doctor's office or outside of the hospital setting. Most of it happens at your home or in your community. Do you have green space? What is the air quality? Do you have access to fresh food? Do you have financial security? Do you have emotional security? Do you have a community of people around you? How do we address those things? We can't be everything to everyone, but how can we begin to provide the support that these patients need? And so relying on non-clinical individuals, community health workers, or in our case, doulas, how these are partners in the care of these women in a non-clinical way, because as much as physicians and nurses want to help, they are under so much pressure in the hospital and office setting to see patients, to make sure that we provide access to care, to address the medical concerns. But the offices and hospitals, especially the offices, are not set up to provide the social support that so many of these patients need. And that's where our fourth trimester coordinators, led by Erica King, who is really the heart and soul of this program, have really helped to close that gap and provide the additional care that these women need that goes outside of just the clinical and medical needs.
You mentioned that postpartum high blood pressure emerged as a leading cause for these readmissions. Can you give me an example of when that happens to a patient? Like, what actually happens? Why is that so concerning for you as a doctor?
So developing hypertension or something called preeclampsia during pregnancy can cause adverse outcomes during the pregnancy itself. It is a leading driver of preterm deliveries. So babies that are born early tend to have higher rates of medical complications. And for mom as well, there are risks for heart attack, for stroke. It's one of the leading causes of maternal death in the United States and globally around the world. It remains a leading driver of maternal mortality. Long-term effects, if during your pregnancy you develop high blood pressure, your risk of developing long-term high blood pressure, type 2 diabetes, stroke, heart attack, and early death are increased even well after pregnancy. So when this occurs, there's the immediate threat of stroke and heart attack, but also the long-term risks. So really capturing these women to help, one, a lot of it is ensuring that they have the means to be able to care for themselves. We provide them with the blood pressure cuff. We make sure that they have their medications on hand before they're discharged from the hospital so that they're able to take it. We also ensure that they have a follow-up appointment with their OB/GYN within the first 2 weeks after delivery to ensure that they have close follow-up to avoid those short-term issues, but also to keep them in the healthcare system so that we're able to help mitigate any long-term risks associated with their high blood pressure that developed during pregnancy.
We've talked about this a little bit, but I did want to ask you just why this fourth trimester, the 12 weeks after having a baby. Did you find that moms, are they even taking care of themselves? Are they so focused on the baby at that point?
I think you nailed it. Yeah, the fourth trimester, like you said, from delivery to 12 weeks postpartum, very, very vulnerable time, because exactly like you said, historically, the focus was on baby. And what was the dogma? Hey, we're going to see your baby in a week, but hey, mom, we'll see you in 6 weeks. And meanwhile, 40% of women don't make it to their postpartum visits because they're just so busy taking care of baby. We know when we look at maternal mortality in the US, we know that about 80% of these deaths are preventable. And so focusing on that postpartum time was an easy sort of focus for us, because we know it's a time where we're able to make a great amount of impact in reminding these moms first and foremost that they're people too, and that they deserve care. And without the mom, there is nobody else. I mean, we need to make sure that we keep them well and healthy, and really making it, almost giving them permission. Like, it's okay to take care of yourself. Like, it's all good. You're not a selfish person. We need you around. And so I think part of that is what Erica and her team have done, like being that big sister, that auntie, that confidant, the friend, that support system, to remind them, hey, you need help too. And more importantly, it's okay to ask for help. It really does take a village. The United States loves to glamorize or romanticize motherhood, but boy, we do not do a good job of supporting moms in that postpartum period. So for all of those reasons, we felt it was best to focus on that postpartum timeframe.
Dr. Fareed Dudeen, can you just talk to me about the response to this program when it was pitched and when it went into effect?
Oh my gosh, we're so grateful. When we launched, it was early December of 2023. And when, Erica was hired, she went through so much training. We had and to this day, so few women opt out. Almost every single woman that has been approached with this program has decided to opt in. And the feedback we have gotten has been tremendous. We didn't have something like this where I delivered in my last baby. I felt like I had a support system that I didn't even realize I needed. The response from our moms was really, really remarkable. And as we started to see the impact on their well-being, and we started to see the improvement in our readmission rates, we started to see so much. Well, we had great support from our leadership. Otherwise, we wouldn't have been able to get this off the ground. But we started to see the concept being embraced by so many other leaders in other areas. And the focus and the attention it's been getting has been really heartwarming, to the point where we've been able to expand. We now have 2 full-time coordinators at one campus and an additional part-time, and then a full-time person we've just expanded to a second campus as well, because the need is just so great.
Do you have concerns about the long-term safety of this program that is focusing on the health of Black women as we see all these attacks on corporate DEI policies?
Looking at healthcare through a health equity lens is really the way to operationalize this work, regardless of what you call it. It's the right thing to do. There is an abundance of data that tells us that health inequities are major drivers of adverse outcomes. There's financial repercussions for hospitals and for patients. So approaching everything we do through the lens of health equity and whole person care, it just really is a part of what we do at AdventHealth. It is looking at that whole person, whether it's their race, their socioeconomic status, their gender, all of those play an important role in their health and their well-being. So operationalizing that and standardizing it, that is our goal. And that is our goal not only for this program, but also as an organization as we move forward. Even regardless of what happens in the political sphere, this work needs to continue if we are going to continue to provide whole person care.
Dr. Rizwana Farid Dudeen is the Executive Medical Director for Women's Services at AdventHealth for Women. Monster trucks have fascinated both young and old since the 1970s, when watching oversized pickup trucks and SUVs crush junked cars under those gigantic wheels was still a novelty. Today, professional monster truck drivers compete at the highest level in the Monster Jam League, televised globally on a weekly basis. Engaged senior producer Richard Copeland stopped by Camping World Stadium earlier this month to meet one of those drivers.
When I was but a wee sprite, I used to watch a show called That's Incredible, a kind of knockoff of Ripley's Believe It or Not. One episode highlighted Bigfoot, not the bipedal hominid residing in the Pacific Northwest, but the giant Ford pickup truck outfitted with 4-foot tires. I was fascinated as one of the first monster trucks absolutely pancaked a row of junked old cars. It was like watching a real-life Matchbox car drive the way kids play with toys. Today, Monster Jam dominates the monster truck universe, with more than 60 drivers on the roster piloting trucks with colorful names like Classroom Crusher, Sparkle Smash, and Vendetta. Earlier this month, Monster Jam, which is headquartered outside of Sarasota, rolled into the Camping World Stadium for its weekly competition, which runs throughout the country. In the parking lot, I met Bari Musawwir among the monster trucks as they were being offloaded. Musawwir calls Apopka home. He's been driving in the Monster Jam League for nearly 15 years, behind the wheels of El Toro Loco and later the Spider-Man truck. He currently competes in Zombie, mocked up to look like the monster truck of the undead. Bari Musawwir also holds the honor of being Monster Jam's first black driver, a distinction he maintains with pride. He and I spoke about being part of this phenomenon, and I began our discussion by asking Musawwir about his first encounter with monster trucks and how he got involved with this.
I'm originally from Cleveland, Ohio, spent a little time in Michigan, and actually that's where my mom took me to my first event at the Pontiac Silverdome, which is no longer even there, so I'm showing my age a little bit. But that's kind of what, made me realize this is what I want to do. I fell in love with the sport at that moment. I was a 6-year-old boy. I didn't know how I was going to get there. I grew up in the city. We didn't, have rural farmland or tractors or ATVs or anything like that. But I got into radio-controlled cars at an early age, and that's actually what kind of led me to be discovered years later. We actually held an RC event at the home of Gravedigger, Digger's Dungeon. It's in Poplar Branch, North Carolina. That was back in 2006.
How old were you then?
I was 26. And that was like my big break, One of the Monster Jam officials just happened to be there. He took notice to our event. He said, man, if you can drive an RC truck that good, you could probably drive the real deal.
So let me ask you about that. I mean, there's a lot of power and a lot of weight between an RC car and Zombie.
Yeah, that's true, but the RC cars, they still apply with the laws of physics when you think about how these trucks fly through the air. It's no different for an RC truck. You can control how the truck is flying through the air by using the throttle or using a little bit of brake to be able to adjust how the truck's flying. So it's pretty amazing that I tell that story and people are just shocked that you can go from that to a full-size truck. But, the hand-eye coordination, the manual dexterity is all something that kind of comes into play applying it to the same full-size truck.
So they give you a tryout. This is 06?
Yeah.
06. So, I mean, this is as you're walking up to this truck, you're climbing in. Talk about that. I mean, this is at that point, this is your 6-year-old dream come true.
Absolutely. It's like you've driven these trucks a million times in your mind, but when you actually get behind the steering wheel and have 1,500 horsepower underneath your right foot, it's kind of daunting. It's like, wow, I'm actually really here doing this. And what these trucks look like performing on the outside versus what you feel on the inside, two different things. So that's a learning curve in itself, especially since these trucks have rear steering. They're 12,000 pounds. They're huge trucks, so they have to have the maneuverability of utilizing that rear steer to get around these tracks. So that took some getting used to. Of course, It was I was a nervous wreck. I didn't show it on the outside, but man, your heart rate goes up, and my heart rate still goes up 15 years later into my career. So it's just something I love, and I've able to been to compete at such a high level for so many years. And I'm just thankful for Feld Entertainment and Monster Jam to be able to give me that opportunity to live out a childhood dream. I'm out here living a dream. This is not a job. I tell everybody I haven't worked in 15 years because I'm doing something that I'm passionate about, and I'm fortunate enough to be able to earn a career at it. So I'm going to keep going until I can't go anymore. I got a young son, Cairo. He's 11 years old, and he wants to follow in my footsteps. So my dream, on top of my childhood dream, is to actually compete with him one day. He's got a few years to go, so hopefully I can hang on that long.
And you've blazed a trail for him as the first black driver in Monster Jam.
Absolutely, so it's a special moment to be able to have these events and to be able to, inspire people that look like me or look like anybody else to, say, hey, you can follow your dreams. It's going to take some hard work, dedication, some passion, but you can achieve it, So I'm here to spread that message all over the world.
How has the access changed since you started? You talked about coming in, you were kind of lucky to have this official at the Gravedigger track. Is there more opportunity now?
I would say yes, because now we have Monster Jam University, where it actually, before Monster Jam University even became a thing, you had to go to the test field, you kind of had to get discovered word of mouth. There was no set way to get involved. You just had to be around. And I followed the sport for years, and people knew my face. They knew, I was into RC, and they knew I wanted to drive. So finally, I just got the right time, right place moment. And honestly, I can't tell you if there's a recipe right now to get involved, but I know the steps after you get noticed are much more refined, because Monster Jam University, you have to graduate from there.
Tell me about Monster Jam University, because in my mind, I'm visualizing monster trucks driving in front of Animal House on the way to class, vying for parking spaces, that kind of thing. What's Monster University? What's that like attending?
It's cool. It's in Paxton, Illinois. It's actually at the home of one of the multi-time Monster Jam world champions, Tom Mintz. He's actually the professor of Monster Jam University. So he's got literally a track in his backyard that mimics the same type of tracks we have here at Camping World Stadium. And you actually have to go through tryouts before you can even attend Monster Jam University. So at first there's a non-motorized tryout, which we strap you in a truck with all the safety gear. We take you through the simulator, which I teach the simulation course. And you actually have a course in interviewing, because you can't just drive the truck. You got to be able to pass that message across to our fans. So we want to make sure that you're honed in on those skills as well. If you pass that non-motorized training, then you get to go to Monster Jam University, MJU for short. And then, you just have to really hone in your skills. And if the professor thinks you have the ability to do this, then you go through rigorous training. It's like a training course until they feel like you're ready for the big leagues.
I assume we're hearing that's a monster truck engine we're hearing.
That is a Monster Jam truck engine. You can feel the horsepower. It shakes the ground.
Feel it through the ground, through my feet. That's amazing. What do you drive?
I got a few different vehicles. Today I had to bring some stuff to the stadium, so I brought my Ram pickup truck, but I got my dream car. I got a C8 Corvette, mid-engine, hard-top convertible. It's red because my favorite color is red, so it's my dream car, man. I was never a car guy. I was always a truck guy until I saw that. I said, you know what? I got to have one. So I worked hard enough, and thankfully I was able to achieve that dream car status.
Oh, okay, Corvette. I was expecting you to say like a 250 Super Duty, dually kind of thing.
Yeah, I've got a 1500 Dodge Ram pickup truck, so.
Bari Musawwir drives the zombie truck for the Monster Jam League. Engage senior producer Richard Copeland spoke with him earlier this month. That's all for today's edition of Engage. All of our shows are available on demand at cfpublic.org. I'm Sharon Stone. Thank you for joining us. All Things Considered is coming up following NPR News.